Hi, I'm Dr. Nilam Khurana, and I'm talking to you today about autism. What does it really mean? There's a lot of misconceptions about what autism really is, and there's also a little bit of fear of the diagnosis. So I wanted to give you a perspective of what it truly is so that you can understand the foundation and the basis and the need for early diagnosis. So autism is a communication disorder first, with some other restrictive or repetitive behaviors. And the communication starts with the lack of nonverbal communication. So if you think about babies communicating with you, they communicate in that nonverbal communication first, starting as early as 4 weeks. And as they grow, that nonverbal communication improves so much that by the time they're 15 months, they're able to understand completely how to get what they need using all nonverbal stuff, not words. Nonverbal meaning not necessarily not sounds, but words are a language that we've put together. And there's different cultures with different languages. And so the foundation of communication starts with all of that nonverbal, being able to have a back and forth communication without using words. So examples, when they're somewhere around 4 to 6 weeks, they start with the smiling at you, cooing, you say something to them, they say something back to you. It's very small. And then you go to when you're going to be having the giggles. So you say something or you do something and you show them something and they giggle. And then of course you're excited about it. And so you say something more and then they'll giggle more. And then you get to just sounds, right? They're not necessarily meaning anything, but you learn a back and forth communication with the ba ba ba, ma ma ma, da da da. And it's not necessarily saying da da, but it's just a communication. And you again say something to them. They don't necessarily understand exactly what you're saying yet, but they know you're communicating with them by the way you're looking at them, the way you're talking to them. They can read your facial expressions and understand whether or not you're happy and playing with them or engaged or interested. And then you get to the point where they can start playing games with you and understanding when you are okay with the game and when you're done with the game. So when they throw the food off the high chair and look at you to see your response, they're communicating with you. When they don't have that foundation, then it's really hard to build on words on top of that. And if we think about it, human beings are not born like cows. The baby calf is ready to go running, right? We have to help our babies and nurture them a lot more in those first years of life to reach their full potential. And this is just an area that as parents, we don't know how to teach our children. We assume they know how to use these skills. And then if we don't teach it to them, then they are a little lost. And so I compare it to walking around in a different country, can't use your hands, can't use your face, and you're trying to communicate with someone. Well, it's tough. You either get really irritated or frustrated, or you start giving up, or you get anxious. There's a lot of emotions that come with it. And so that is an important part that I want parents to understand regarding autism, because in the first, and I've said this many times, in the first 5 years of their life, 90% of their brain is developing. And so if they are going off track from what we want to do, as far as trying to help them communicate, then we can help them get back on track. The brain creates all these connections in the first couple of years. And then, just like a tree, you prune it a little bit and it allows it to grow, right? You can prune the tree so that you can get it taller, or if you want it broader, that's the way their brains work. And so if we learn early, okay, this is what's going on with my baby. My baby is not understanding these nonverbal things. Then we can help them. Then we just need to get an evaluation, get a diagnosis, get them into therapy, And those therapists are skilled in being able to help children understand nonverbal. So an example that I give is if your child is sad and upset about something, well, they have their own way of expressing that. They have their own way of feeling that, and they don't understand necessarily that when they look at you and you're sad, that you are sad. They don't know. That's a word. Again, it's not a connection. And so if the child doesn't understand what your expression means, but they do understand that there is a label for that feeling, we can help them bridge the gap. So if they feel sad, they're in a situation, the therapist can say, oh, this is how you feel sad. And then they can show them pictures and show them expressions and help them understand, well, that's the same thing as what this person is feeling. And then it connects the dots and it helps them understand. There's a lot of misconceptions about autism and lack of empathy. It's just not true. It's not that they have lack of empathy, it's a communication gap. And so if we don't help them build that connection, then they will wander off into their own high anxiety, frustrated world that they can't relate to anybody or communicate with anybody. But it's not a lack of empathy. And once we get these kiddos going into therapies, we see all of these things that they are wanting to express, but they've not been able to. Now, there's also the restrictive repetitive behaviors, and there's a lot of different things that can be in there. So people typically think of the child flapping their hands or lining toys up in a line, like cars up in a line or something like that. Or maybe being upset by noise or crowds. Again, there's lots of different things that they can have in that restricted repetitive behavior area. And I am not a developmental pediatrician, so I have trained to learn to diagnose autism, and I've learned through my experience with all the kids. And so scientifically, I can't tell you, but what I can tell you through my experience is that as these kids have learned to communicate better, I've seen those other areas of restrictive repetitive behaviors calm down. And it's not that they're even working on those things. They're working on trying to not reinforce those if they're things we don't want them to have. They're working on helping build the communication with therapies, but it's not like they're saying, you need to stop doing this, because that's not the focus. The focus is building that communication. And then if they have some strong desire to have this sensory seeking behavior for playing with water, as long as it's functional and it's okay and it's safe, that's fine. And then maybe that kid's gonna be the next, Phelps. What we need to do is we need to help them just build that foundation so that they can communicate. And then those other behaviors and those other things that are concerning to parents when they see, those we can work on. But if we don't bridge that communication gap, then they suffer. And then even kids who are very high functioning, they later may have some anxiety or depression because they're not really understanding things. I've talked to lots of parents who actually were like, oh, you know what, I think I had it. And they just never diagnosed it back then because it's a spectrum. And when they decided to put all of these higher functioning kiddos on the spectrum, it really opened up the number of people that are getting diagnosed, but it also made some people feel uncomfortable because they are thinking the more severe kiddos with autism are the same as the kiddos that are higher functioning. And in reality, it doesn't even matter where you start. What matters is getting that early intervention, because I've had kids come into the room not wanting to even recognize me, screaming as soon as they see me, and then 2 years later, after intense therapy, they're sitting up on the bed and talking to me. This is like if they get that early diagnosis, like a 2-year-old when I diagnosed, and then when he was 4, he came back in. So the main point is early diagnosis is key. I have put up a bunch of things for the first year and a half of life regarding the developmental milestones I want kids to be meeting. And I've really put an intense focus on social emotional development because I think that's the part that a lot of parents just don't know, don't understand that we need to be teaching our kids. And then on top of that, with everything COVID, there's been that isolation and a lot of people not necessarily giving their kids everything that they need because they're trying to juggle two parents working at home on computers and, you know, a kid who needs all the attention of a full-time caregiver. So whatever the case may be, I want you guys to be aware of all the different developmental milestones they should be meeting, especially with social emotional, because they don't really know as parents how to teach this to kids. We just know we're supposed to teach them to eat and teach them to walk and teach them to talk and all these other things, but that social emotional foundation is an essential part that we take for granted that every child has. But as we've seen, the rates of autism are a lot higher than we thought they were, and so there's a significant portion of kids who just don't have that foundation. And early recognition and early therapy will make a huge difference for that child. So my goal is that more and more kids will get an early diagnosis. And so if you're watching this video and you think your child may be on the spectrum, get an evaluation. It doesn't hurt. If you don't think your child is on the spectrum, but you are passionate about helping other kids get an early diagnosis, spread the word. Please tell more people about this video and my series through 18 months so that parents can understand and they can start getting the help that they need for their child. Thank you so much for listening, and I look forward to talking to you more about some of the other layers of child development and probably a little bit more about autism as we go.